Everybody. I'm really thrilled to be here this afternoon with all of you. My name's Maureen Fannin. I'm the director of the dental hygiene program here at Malcolm X College. So I'd like to share with you a little bit about the profession of dental hygiene for those of you that maybe don't know what dental hygiene is, and also about the program here at Malcolm X College. And then, of course, answer any questions that you may have.
Good afternoon, everyone. I'm so glad to see so many participants. This is so exciting. I am the admission specialist for the dental hygiene program. So I will speak to many of the students that applied for our program, and I will guide you to how to apply once you've applied, what to look for, what are the requirements, what I need from you, and what you need from me. Since it is virtual, everything you would be doing is pretty much on your own with our assistants. So please feel free to reach out to me via email if you have any questions regarding the selective admission.
Thank you, Lisa. Back to you, Maureen.
Okay, so dental hygiene, this is what we look like nowadays when we're working in this COVID environment. This is we've got gowns, we have face masks, we've got hair bonnets, we've got gloves, extra eyewear. So this is the new dental hygiene. It's kind of suffocating in all of this, what we call PPE, but this is how we're working. This is how we're working nowadays. Oops. Let me see what's wrong here. I'm having issues here with my computer. Go to the next slide. Sorry, everybody. As usual, technical issues with my computer here. Oh, here we go. Okay, so as you know, there are a lot of health science programs here at Malcolm X College, and today we're talking about dental hygiene. And dental hygiene, when you graduate from the dental hygiene program, you receive an associate in applied science in dental hygiene. So for those of you that don't know, I'd like to talk a little bit about what a dental hygienist does. First of all, as hygienists, we work with dentists. So you can't work on your own. You work under the supervision of a dentist. So it's really nice. It's like a team kind of environment. So there's the dentist, the hygienist, and we work together. The dentist has their specialty in fixing teeth and doing cavities, and as hygienists we're like the experts in prevention of dental disease, so we work really well together. So some of the things that we do, clean teeth, educate patients about oral health, we take x-rays. A big thing nowadays that's really important is that we perform oral cancer exams, and like I said before, we're really the true specialists in preventing oral disease or mouth disease. So these are some of the procedures that we perform. So we take x-rays that look like this. So for those of you that have been to the dentist or had perhaps like your wisdom teeth removed, this is the type of x-ray, the Panorex x-ray is the kind of x-ray that we, let me get my pointer here so I can make a point. Move my mouse here. Sorry. So these are the panoramic x-rays. Like I mentioned, we do oral cancer screenings, and the tongue is one of the most frequent sites for oral cancer. So we check that area really closely. We teach patients how to brush their teeth, the proper way to brush their teeth. So all of you out there should be using a soft toothbrush. We clean teeth. So I don't know if you can see here, there's all this kind of like white stuff on this patient's teeth that needs to be cleaned off, the calculus or the tartar. So we do that. We use hand instruments. We use motorized instruments. We give fluoride treatments. There's other procedures that we do, but these are the main procedures. So when you're in the dental hygiene program, which is 2 years here at Malcolm X College, you learn to do all of these different types of procedures. So you might be asking, what do I have to do to become a dental hygienist? So the first thing that I would recommend is that you do well in your math and science courses. So what research has shown us is that students that do well, particularly in science, can be successful in the dental hygiene program. It's important that you take the required prerequisite courses, and I'll talk a little bit about that in a moment. It's always a good idea to observe a dental hygienist, not a dentist, but a dental hygienist, because you might say, oh yeah, I want to be a dental hygienist, and then you watch what they do and you think like, oh, I don't like to look in the mouth. Okay, so if you don't like to look in the mouth, that grosses you out, and perhaps medical assisting or respiratory care or something else would be the profession for you. And like I mentioned before, the dental hygiene program is 2 years. So for us here at Malcolm X College, and this does change based upon the school, but we're the only school right now that in the city of Chicago. So as far as prerequisites, and these are courses that need to be taken prior to applying to the program. So a general biology class, which for us here at Malcolm X College is Biology 121. 2 anatomy and physiology classes with a lab. So for us at Malcolm X, it's Biology 226 and Biology 227. We also require microbiology, which at Malcolm X is Microbiology 233, and then speech. So these prerequisite courses are mandated by, we have like a governing body that sort of oversees the profession of dental hygiene. So they sort of tell us these are the courses that students need to take to get into the program. So I don't make these courses up. The president of the college doesn't make these courses up. They're defined by our accrediting body. All right, the next, here we go. Then in order to receive your associate's degree, there are other, what we call like program support courses that you need to take in order to receive your associate's degree. So here for us at Malcolm X College, math 118, chemistry 121, English 101, psychology, and sociology. So that's a total of 17 hours. And generally speaking, students who are accepted into the dental hygiene program complete the support courses plus the prerequisite courses prior to applying to the program. And to apply to the program, it's a 2-step process in that first you apply to city colleges, all right, to the selective enrollment dental hygiene program. And then once you apply to the selective enrollment program, then Miss Ayala and her team, like the admissions team, they review your application to ensure that you have a 2.8 GPA, that you've met all the prerequisite courses, that you've submitted all of your transcripts. So, and then once they've determined that you meet the minimum requirements, then I get a notification and then we send you the admissions packet. And that's another whole set of requirements. And so it's those sets of requirements that I'm telling you to check the website for in late August so that you know exactly what they will be for the next application cycle.
The important points Ms. Fannin made today included that the application requirement has a 2.8 GPA. It is about 2 years to be in the program, which is about 6 semesters. You should budget for about $20,000 to complete the program. Financial aid can be used for that. You should mentor and shadow and get connected with people that are in the program or dental hygienists like actively live right now to see if this is what you want. Always make a backup plan. And most importantly, after today, make an appointment with your advisor just to make sure, like if you plan on applying the next cycle, and you want to stay on track, you should be able to map out all your classes with them and say you have to take off a semester or you fail a class, like factor that in and see how that adjusts your timeline. And think about what you're going to do in the in-between time if the application's not going to be open for so many months and you've already finished all your classes. So make an appointment with your advisor.